Last year, Diabetes UK reported that almost 4 million people in the UK are living with diabetes. Around 90% of these cases are classed as type 2, which is often linked with obesity. Interestingly, type 2 diabetes has been reversed in patients undergoing weight loss surgery who've been able to leave hospital after only a few days, no longer needing their diabetes medication. Studies have suggested it's not the surgery itself, but the calorie-restricted diet that follows, which is responsible. Now, a team at Yale University has investigated the biological mechanisms by which this reversal is made possible. I'm Heather Walk, and I spoke to Dr. Rachel Perry.
We generated type 2 diabetes in rats by feeding them a high-fat diet and treating them with a drug that makes them less likely to secrete insulin, which is the glucose-lowering hormone. And we put them on a caloric-restricted diet, giving them a quarter of their daily caloric intake each day for 3 days. And within just that 3-day period, we saw a large lowering of plasma glucose. So blood sugars went down not quite to normal, but much better than they were in the control diabetic rats. And so then we sought to understand what's the mechanism by which this happens. We used a novel method called positional isotopomer NMR tracer analysis, or PINTA is the acronym, to measure the specific metabolic pathways that contribute to high blood sugar in these diabetic rats. Blood sugars are high in part because the liver makes too much glucose in diabetes. This process is improved with caloric restriction. We found that the glucose-lowering effect of caloric restriction occurs because of reductions in 3 pathways that contribute to high blood sugar. Number 1, it reduces breakdown of glycogen, which is the short-term storage form of glucose. Number 2, it lowers the synthesis of new glucose. And number 3, it lowers fat accumulation in the liver, which improves the liver's response to insulin. We were also impressed that we were able to observe such large reductions in blood sugar without significant weight loss. Although I'm sure that if we continued the caloric restriction for a longer time, we would have seen weight loss eventually. So this suggests that with just a couple days of reduced caloric intake, you may be able to get a significant metabolic benefit.
Will you be repeating this low-calorie diet study with humans?
Absolutely. It's easier said than done for any of us to go on a very low-calorie diet. I don't know that I'd love to sign up to eat a quarter of my daily caloric intake. But of course, the most important question is, do these results translate to humans?
And do you think that will lead to a treatment that's diet-based in humans or something more medical?
We could identify either diet-based or medical treatments from these studies if the findings are replicated in humans. And that is because while it would be great if humans would be able to follow this caloric-restricted diet, one of the main benefits of this study is that it identifies molecular pathways by which caloric restriction leads to a reversal of diabetes. In theory, you could do it by diet or by targeting any of the 3, or better yet, all of the 3 pathways that we found in this study.
Do you think that sometime in hopefully the near future, we'll be able to completely reverse type 2 diabetes in all people with the condition?
I think so. There are a number of interventions that people are working on. We have one ourselves. This drug burns liver fat. That's a mechanism similar to what we found in this study. With caloric restriction, you're able to reduce liver fat and reverse type 2 diabetes. So I think that interventions based on reducing liver fat content and thereby improving liver insulin responsiveness are going to be the way to go.
That was Dr. Rachel Perry from Yale University. The study was published in Cell Metabolism.